Two things to know about me. First, I love all sports. And second, I have no natural talent for any of them. So a few summers ago when I was learning how to skateboard, it's no surprise that the skateboard went this way and I went this way. I landed hard on my shoulder. I thought it might be broken, and so I showed up to urgent care via car, not skateboard. Since I'm really clumsy, this wasn't the first or the second or the third time that I'd been in front of a provider with a suspected broken arm. But it was the first time since I came out as transgender. Since I've been in this situation a number of times, I have an idea of what this interaction is going to go like. The provider's gonna say, "What brings you in today?" I'll say, "I think I broke my arm." They'll say, "Oh, so sorry to hear about that." They'll move my arm a little bit, ask what hurts. They'll then gather some information about my sexual health history to see if I might be pregnant before sending me back for x-rays. Instead, this interaction went something like this. The provider says, "What brings you in today?" I say, "I think I broke my arm." And he's flipping through my chart and says, "Testoster, oh, so you're, and I said, "Yeah, I'm, And he shifts in his seat and he looks at the door and then he launches into a series of questions that I didn't expect. How long have you known you were transgender? How long have you been on hormones? Are you sure? What surgeries have you had? Are you sure? What surgeries do you want to have? Are you sure? When was the last time you were tested for HIV? Are you sure? About 10 minutes into this line of questioning, I say, "I'm so sorry, sir, but I don't see how any of this is relevant for my shoulder." He never asks any sexual health history questions or if I might be pregnant before sending me back for an x-ray, and he never touches me. This experience, where a provider becomes fixated on someone's transgender identity instead of the concern that brought them in, is so common that it has a name. And funny enough, that name is trans broken arm syndrome. But this experience wasn't bad, at least in the spectrum of trans healthcare experiences. I got in the door, didn't I? 40% of trans people have avoided necessary care because of fear of anticipated discrimination. I ended up getting the care that I needed, even if it took a little advocacy. 20% of trans people have been denied healthcare by a provider because of their identity. And I didn't get assaulted. 18% of trans people have been physically or sexually assaulted by a provider. We've known for a long time that trans people and cis people have different kinds of experiences in healthcare settings. But most of that data comes from stories like mine. And because it isn't objective, hard, quantitative fact, policymakers and providers haven't listened. This is the gap that my research seeks to fill. I use long-established objective measures of healthcare quality to compare cisgender and transgender patients. I look at things like how likely someone is to get a statin for their diabetes and how likely someone is to get a bronchodilator when their COPD acts up. What I find across 8 different measures is that trans people receive worse quality care across 8 measures. To give one example, trans people with diabetes are 38% less likely to receive a statin than a similar cisgender person. But I don't think this research is reason to despair. Another part of my research looks at providers' previous experience with transgender patients. The providers who have seen trans people the most often had the smallest disparities in quality of care. And we also see providers learning. The more patients that a provider sees, the more their quality of care improves for those trans people. Trans people deserve quality health care. We deserve it for hormones and heart attacks, for shingles and broken shoulders. And when providers see us, they begin to really see us. Thank you.